Excellencies, distinguished guests, welcome to ESCAP's regional conversation on promoting regional cooperation to enhance equitable access to essential health products. My name is Rupa Chanda. I'm the Director of the Trade, Investment and Innovation Division in ESCAP. I have the honor to moderate this conversation. This regional conversation is structured along two segments. The first is the high-level segment, where we will hear the views of senior luminaries, including the Executive Secretary of ESCAP, Ms. Armida Salcia Alice-Jabana, Mr. Nicolasi Apinelu, Permanent Secretary, Ministry of Fisheries and Trade of Tuvalu, Mr. Satvinder Singh, Deputy Secretary General ASEAN, Dr. Mariangela Simao, Assistant Director General, Access to Medicines and Health Products, WHO, and Mr. John Denton, Secretary General, International Chamber of Commerce. This will be followed by a high-level interactive panel discussion of 4 experts, which I'm sure all of us will enjoy immensely. I will introduce the panelists when we start the discussion. It is now my pleasure to give the floor to Ms. Armida Salcia Alice-Jabana, United Nations Under-Secretary General and Executive Secretary of ESCAP, for her welcome remarks. Ibu Armida, the floor is yours.
Thank you very much, Rupa. Excellencies, distinguished participants, ladies and gentlemen, a very good afternoon and greetings from Bangkok. Welcome to our regional conversation on promoting regional cooperation for enhancing access to essential health products. This is the 4th event in the series, which has focused on priority areas where ESCAP can support member states in their post-COVID-19 recovery efforts and their journey towards achieving SDGs. Securing equitable access to essential health products to combat the pandemic remains the most urgent and relevant issue for our region today. Since our last conversation in November last year, coronavirus infection and deaths have shown no sign of slowing. Cases have almost doubled to, unfortunately, 450 million, and another 1 million people have died. The Omicron variant has been less malignant, but more transmissible. And together with other variants of concern, it continues to lead to hospitalization and deaths. Vaccines and other essential health products like therapeutics and diagnostics have proven effective in lessening the impact of the virus. But however, access to these products in some populations remains severely limited. Access has been stifled by limited and uneven production capacity, high levels of procurement by more developed countries, customs and regulatory compliance-related delays, and transportation and logistics issues in the supply chain. So many countries in our region have opened their borders over the past few months, a step toward easing supply chain issues and bringing the world closer together in the pandemic response. But other challenges remain. Regional manufacturing capacity for vaccine, diagnostic, and therapeutics is essential for the reliable delivery of these products to regional population, especially those in more remote parts. In previous events, we have discussed extensively on existing initiatives and identified areas for regional cooperation in building upon and strengthening them. So therefore today, this afternoon, our focus is on the steps we can take to promote regional cooperation and the particular role of regional value chain, trade, investment, and research and development in achieving this goal. Our objective is to highlight the possibilities for regional cooperation in these areas to enable equitable and affordable access to essential health products in our region, in countries in our region, Asia Pacific. Today, I have the honor and privilege to welcome high-level policymakers and distinguished experts, speakers from the region to discuss lessons learned from this pandemic and the next steps for promoting regional cooperation for enhancing access to these products to ensure better preparedness in the future. Today's participant will provide greater insights into the challenges faced by policymakers at the domestic level, the opportunities already captured by the private sector, and the best practices that might be adopted to address these challenges. Last year, Commission adopted a resolution that should be, more than ever, serves as the fundamental driver of our COVID-19 response. ESCAP member states recognize that to bring the pandemic to an end, every country must have universal, equitable, and timely access to quality, safe, efficacious, affordable diagnostic, therapeutics, and medicine and vaccines, as well as essential health technology, their components, equipment for the COVID-19 response. In the years since, WHO, UN entities, and development banks have introduced concrete initiatives to support this goal, including, as all of you are aware, WHO ACT Accelerator, as well as the ADB's Asia Pacific Vaccine Access Facility. In this part, we have complemented efforts thus far by organizing this regional conversation series, as well as the Lab2Jab research initiative in collaboration with WHO, in the hope that we can identify concrete avenues to securing universal access to health technology. We have also provided tools and technical assistance on trade and health, and a project is in the pipeline focused on strengthening the capacity of member states in this area. I would like to take this opportunity to remind everyone to be ambitious, but of course, at the same time also, we must be equally realistic in making proposals and suggested action. I look forward to your insight and further deliberation and recommendation. Thank you very much.
Thank you, Ibu Armida, for setting the stage so well for this conversation. It is now my honor and pleasure to invite Mr. Nicolasi Apinelu, Permanent Secretary, Ministry of Fisheries and Trade of Tuvalu, to talk about the issues and challenges the Pacific Island countries are facing with the supply of vaccines and other essential health products, and solicit his views on regional cooperation to tackle such challenges during this pandemic and to prepare better for future crises. Mr. Apinelu, you have the floor.
Thank you, facilitator. I must also convey my gratitude to the impressive opening remarks from Ms. Amin. On behalf of the Tuvalu government, I would like to thank the ESCAP for the opportunity to be part of this regional discussion. As you may well be aware that Tuvalu is a small remote island state and currently is COVID-free, but borders remain closed because of our lack of health infrastructures and facilities. Stringent measures and standard operating procedures had to be in place. We have a population of just under 11,000 people spread across the 8 islands of Tuvalu. Most of our islands are flat, and we are in the front line of the climate change issues that now affect us all. These 2 issues are very much important: the climate change issue as well as the COVID pandemic. As a smaller island state, we are at times at a disadvantage, especially in accessing quality and affordable health products. Therefore, allow me to use this opportunity to share the challenges faced by Tuvalu. Supply challenges for vaccine, including COVID-19 vaccines and routine and medical supplies. COVID-19 restrictions in some of the countries where we are getting our medical supplies from have affected logistics on our orders. Some items not even available. If available, they will be in small quantities. and even some items supplied with short expiry dates. Our closed borders also lead to no flights, which our supplies will have to be shipped. This takes longer than usual. No flight affects our old store items, example vaccines. They will have to be transported by air, as it is the only means of maintaining the required temperatures for these medical supplies. Ministry of Health have requested the World Health Organization on some supplies, example, laboratory COVID-19 test kits, and they continue to assist us by sending it through whenever there are flights to Tuvalu. The same goes for UNICEF and their assistance in providing vaccines. They assist the Ministry of Health in organizing and procuring COVID-19 vaccines through COVAX or donor funds from Australia and New Zealand. There is no one-size-fits-all procurement policy for the region, given that all countries have their own well-developed procurement procedures, particularly for medical supplies. We have requested regional cooperation on pool procurement in the past so that the small island state like Tuvalu can benefit from such an initiative. Reduce price on items because of the large quantities of items put together from different countries. We were bound to reap the benefit of such initiative, but no big countries like Fiji, Samoa, or Tonga would not take the risk because of the many reasons, one of which is currency. COVID-19 did not help. It's just extended our current struggles with supply chains. The above tale was a history. But moving forward, we would need to strengthen our relationship with current suppliers and our supplies management system and keep asking Fiji, Samoa, Tonga to assist us. We always ask WHO and other UN agencies to assist us sustaining our supplies. Currently, the Tuvalu Department of Trade is conducting a negotiating and exercise with the World Bank Trade Division on an expedited shipping assistance for Tuvalu. A similar exercise was done and completed in Tonga, and it was timely as it ensured a quick supply of vaccines and pharmaceutical products for Tonga amidst the volcano eruptions and the COVID breakout. Therefore, this partnership with the World Bank, once implemented, will bring together all key government departments, stakeholders from customs, marine, health, trade, and private sector to ensure that expedited shipment of vaccines and pharmaceutical products are conducted in a timely manner and with all considerations on COVID-safe protocols observed. Tuvalu has also engaged with ESCAP on the development of the Tuvalu National Trade Development Strategy. Together with the enhanced integrated framework Tuvalu project team. This strategy also contains several key components to facilitate trade, not only within Tuvalu, but regionally and internationally. While developing the strategy, we understood that for any strategy to be a success, good partnership is vital, and especially the relationship with regional and international organizations. Therefore, we found it out that for small island states such as Tuvalu to be able to get the essential assistance it needs, be it the vaccine or pharmaceutical product, we really need and humbly request the cooperation from our partners within the region and international. Ladies and gentlemen who are joining us in this virtual platform, thank you very much for the opportunity to share what small island state like Tuvalu experiences. and what we are doing to catch up. It is my sincere hope that through this regional dialogue, we not only talk and share, but also come up with pragmatic way forward for the benefit of all in our region. Thank you, and Tuvalu Motetua.
Thank you very much, Mr. Apinelu, for your perspectives and insightful remarks. We will now hear from Mr. Satvinder Singh, Deputy Secretary General, ASEAN, on the importance of regional integration arrangements in enhancing access to essential health products and how regional blocs such as ASEAN can help address trade, investment, supply chain, and other challenges which impede access and therefore facilitate pandemic preparedness and response through cooperation.
Your Excellency, Alice Chavana, the Under-Secretary General of United Nations, and the Executive Secretary of ESCAP, fellow distinguished speakers, dear panelists, participants, ladies and gentlemen. On the onset, let me first thank the UN ESCAP for inviting the ASEAN Secretariat at this very important forum, a forum that's actually touching on the enhancement of regional value chains, particularly in relation to strengthening of the flow of essential health products. As you know, this is extremely critical today for all of us in the ASEAN in order for us to overcome the impact of the pandemic and for us to recover our economies. Indeed, I must say, ensuring supply chain connectivity has been one of the areas that ASEAN has paid a lot of attention to throughout the entire last 2 years, as we all are working very hard to reopen our economies and live with the COVID. Now, most of our ASEAN member states have ensured that essential services, including the flow of air services, the roads, the ports, the supply chain nodes, they all remain open despite all of the challenges and disruptions that we have faced. And going from how we manage the pandemic challenges the last 2 years, especially in regional value chain ecosystem and flows, when dealing with COVID, I believe that all of us, not just the regulators and government, I'm also talking about our private sectors, are also a lot better prepared today. Let me share some of the best interventions and some of the best efforts that the ASEAN region has put into place the last 2 years to overcome the pandemic challenges in supply chain, especially when it deals with health products. But as early as 2020, the ASEAN leaders got together and they adopted the Hanoi Plan of Action on strengthening of the ASEAN economic cooperation in supply chain connectivity. Basically, it aimed to ensure smooth flow and transit of essential products during the pandemic, with a very long-term strengthening of supply chain connectivity and resilience in mind. As a follow-up of this initiative, the ASEAN policy regulators also got together and they launched the Memorandum of Understanding on the implementation of non-tariff measures on essential goods. Basically, what it does is it refrains the ASEAN member states from imposing restrictive trade measures on hundreds of essential goods and supplies, except for public health emergencies. This list is expanded to almost 257 items. It consists of also some key goods in the healthcare areas, which includes vaccines, test kits, medical supplies and equipment, of course some food and agriculture products too. Discussions are now currently undergoing to further expand this list in 2022 and to include more essential goods that are going to be necessary in the support of manufacturing and distributions of vaccines and medical supplies needed by the communities in the ASEAN region to combat not just the current COVID, but also future pandemics. Additional measure is also put into place for the market to be able to be open to trade and investment. And I must assure you that we've also, for the private sector and for regulators, we also introduced the non-tariff measures cost-effective toolkit. This toolkit was an initiative that was endorsed last year by the leaders. It encourages the adoption of good regulatory practices in simplifying import requirements and procedures to ultimately boost our exports to the region. And particularly this toolkit actually hopefully will be playing a very crucial role in managing non-tariff measures that may potentially affect the smooth flow of goods within the region. This is where digital transformation is key. And we have kind of embraced some of that in the way we are making it easier, cheaper, faster, better connected for traders to be able to do cross-border trade. Furthermore, what we saw in the middle of the pandemic the last 2 years, our ASEAN member states have actually, our leaders have actually come forward to complete one of the largest FTAs with our most important trading partners. Now, this FTA is called the RCEP, the Regional Comprehensive Economic Partnership. I think as we are all as a region thinking about setting up manufacturing capacities for not just vaccines production, but also medical supplies and equipment, this whole ability for global manufacturers to take advantage of the global value chain advantages of RCEP, to sit and take advantage of the factors of production from the 15 trading nations all in one go. I think that itself, it's a formidable tool that once again is going to be allowing our region to really embrace and be able to invest into some of these global health value chain manufacturing capacities and distribution capacities. But I do believe that moving forward, a number of critical areas we need to address. I think first, it is imperative for the region to continue reducing our inequalities of vaccine manufacturing, distribution, and administration. We are hoping that there's effort, a regional effort to all come together to start rebuilding and reinvesting even more the capacities for vaccine manufacturing so that we can enable more equitable, a lot more affordable COVID-19 vaccines for all the populations of the region. Now, to do so, I also believe several bottlenecks will also need to be addressed. Now, this particularly will be necessary for us to start looking at things like the proper setup or transfer of research and development, the availability of essential raw materials and seamless movement, the availability of global talent, regional talent, technical experts, and of course, the need for harmonization, regulatory standards in regards to some of these medical products. Second, we believe that the region will also benefit from the strengthening of the investment facilitation for vaccine-related product manufacturing. In fact, speeding up approvals will be one example for such investments coming to our region. Even provision provided in terms of tax incentives or grants or allowances will all go a long way in supporting such development. Third, I believe the region can also achieve much in our efforts by simplifying even more the custom procedures. More definitely become done in our region, even though a lot has been improved. Countries, for example, can be encouraged to invest more in digital infrastructure, such as through the use of electronic pre-arrival processing, electronic data exchange between relevant border agencies in order to improve the cooperation mechanisms and the risk management for clearances for such essential vaccines and medical-related products. And finally, strategies must also be in place to ensure that the supply chains of vaccines and related products are resilient, including better risk management. In fact, cross-sectoral coordination between the trade, the health, the logistics supply chain players is definitely much needed and welcomed. And I think this is definitely an area specifically where both public-private cooperation would really go a very long way in strengthening our ability to deliver essential health and medical support and supply to our people in the region. Your Excellencies, ladies and gentlemen, please allow me to close by emphasizing that while the pandemic has really presented the ASEAN region with unprecedented challenges, it has also given us a huge amount of opportunity to further work together to recover better and be stronger for a better tomorrow. It is with this in mind, I truly wish that the outcome of your discussions today will definitely bring about even more innovative and forward-looking solutions for our region in order to strengthen our regional value chains on essential health products.
I would now like to invite Dr. Mariangela Simao, Assistant Director General, Access to Medicines and Health Products, WHO, to share her views regarding the current inequities in vaccine production, R&D, and distribution, as well as in access to other essential health products. and also to reflect on how regional cooperation can help address this issue and the role of the WHO and its regional bodies in this regard. Dr. Simao, the floor is yours.
Thank you very much, Chair. Good morning, good afternoon, and good evening. I'm still in good morning here. And thank you, Chair, and I'd like to thank ESCAP for the invite, for WHO being invited to speak in this forum. No, it's now more than 2 years since WHO issued what we call the highest alert from the International Health Regulations, which is a public health emergency of international concern. And 2 years on, we are still fighting this virus, right? We see that in countries with high vaccine coverage, even in the presence of Omicron, which is highly transmissible and increasing number of cases, there's a dangerous narrative that the pandemic is over. And we say, WHO is reiterating, it's not over yet. Not over when we have 12 million new cases and more than 40,000 deaths were reported last week. And although we say now that COVID-19 is both preventable and treatable, right? Now we have each country facing a different situation and different challenge. Not over. We see increasing number of cases from last week in the Asia region, and we do have the right conditions right now for the appearance of new variants. For example, we have a decrease in the use of the public health and social measures on testing in many countries, and we do have a very uneven vaccine coverage. So a little bit on the vaccine inequity, we have more than 11 billion doses have been used globally, but as of last week, we had 22 member states that had vaccinated less than 10% of their population and 75 less than 40%. At the same time, we have high-income countries have administered 10 times more doses per inhabitant when compared to low-income countries. So WHO's target is that all countries reach 70% coverage by mid-2022, and this is to ensure that we can end this the acute phase of this pandemic. We have the tools, we have the know-how, and we ask countries to remain vigilant, to continue to vaccinate people, to go to vaccination, to provide countries to provide care, and also to apply the public health measures with a common sense approach to protect populations. We all know that vaccines are the most powerful inventions in human history, and we know that they were developed really fast in record time. It's a triumph from science that has helped to change the course of this pandemic. At the same time, that the reality of persistent inequity in access still needs to be addressed. And it's also become very clear during this pandemic how fragile we are. And Mr. Apinello, he just referred to other fragilities in the supply chains, but let me highlight the production of vaccines, biological medicines, and even the personal protective equipment, which is very concentrated in a few countries. And there is enormous interest from member states and regional bodies. Very happy to be here today in investing in local production. You will have heard that WHO and partners, we have established an mRNA technology transfer hub in South Africa, together with the Afrigen, BioVac, the South African Medical Research Council, the African CDC, and the Medicines Patent Pool. And the aim of this hub is to provide a facility where manufacturers from low and middle income countries can receive training on how to produce mRNA vaccines. And we believe this technology transfer hub holds huge promises, not just for increasing access for vaccines against COVID, but also because it sets the base to investigate and develop for vaccines for malaria, tuberculosis, and some of the cancers. And recently, the partner in South Africa, Afrigen, has announced that they produced their own vaccine, mRNA vaccine candidate, which will go into clinical trials later this year. But it's important to mention that this process could have been accelerated if one of the two originator companies had been willing to share intellectual property and know-how with the hub, which did not happen. For the mRNA technology hub, there are 13 spokes, that's how WHO is calling the countries that will benefit from the training, and 4 are in Asia: Bangladesh, Indonesia, Pakistan, and Vietnam. We also had proposals from India and from China, but there were many manufacturers in these two countries, so they're still under assessment. These countries will benefit from training on mRNA technologies in South Africa. And we think that for the future, and also thinking of regional capacity, this hub and spoke model is a good way forward. Another activity that WHO has launched, and it is also located in the ASEAN region, is the the fact that the biomanufacturing facilities, they are very much located in high-income countries, like putting the biotherapeutics like monoclonal antibodies out of reach for many countries. And this is already cause of inequity in access to some COVID products, not only vaccines. So we have partnered with the Republic of Korea to establish a global biomanufacturing training hub that will also serve low and middle income countries that wish to produce not only vaccines, but other things like insulin and monoclonal antibodies. And local production is critical. Increasing, diversifying the supply chain, increasing local production is critical, not only now, but for the future. And we are saying also that diversification of production is key to having a reliable supply of safe, efficacious medicines, vaccines, and other health products. Because this will not only make the world more resilient against future pandemics, but it will also create jobs and economic opportunities. So, and this is a role, I think the ASEAN collaboration on training, tech transfer, research, strengthening regulatory systems, like the Deputy Secretary of ASEAN has just raised. They are key, and the engagement of the regional bodies are essential. Let me touch briefly on the IP discussion, because there is a lot of discussion on the IP protections in pandemics, and WHO, you may know, strongly supports the proposals from South Africa and India for a temporary waiver of the intellectual property rights on the TRIPS agreement during the pandemic. We are aware that a compromise text is being discussed at the TRIPS Council this week. And this is particularly important now because last week, WIPO launched a report that showed that there is a rapid patent activity for new vaccines and therapeutics in COVID. And WHO is urging all countries to explore all avenues to manage IP in health-related issues. And we launched in 2020 at the request of Costa Rica and many of the countries in the Asia-Pacific region, the COVID Technology Access Pool, also known as CITA, that aims to promote voluntary license to share intellectual property through the medicines patent pool and to promote sharing know-how in data. We will soon launch an open database on key COVID-19 products, patent status, and licensing information. We had the first licensing agreement with the Spanish National Research Council, and we recently also received a proposal for several technologies from the US National Institutes of Health. And we're working with other developers as well. Some of them are from your region. And we are at the final stages of negotiating some other license. Now to finalize, I'm going back to the vaccine part, right? Because we have WHO, UNICEF, Gavi, with COVAX partners working non-stop to address what we now call the delivery bottlenecks that remain in achieving 70% coverage in all countries. And going through this pandemic and better prepare for the next requires that we work across the public and private sector for the greater good, and this is a debate you're doing it today at the regional level. That's very important to happen. And as we speak, at the WHO, there is an intergovernmental negotiating body discussing the possibility of pandemic treaty or another type of agreement that will help us when the next pandemic hits us. And let me end, I just want to quote my boss, Dr. Tedros, because he says something that touches the heart of equity, right? He says that we all want a world in which science triumphs over misinformation, solidarity triumphs over division, and equity is a reality, not an aspiration. If this is the world we want, we need to start working for that world right now. And I'll hand back to you, Chair, and thank you very much for the opportunity to speak here.
Thank you very much, Dr. Simao, for your perspectives and insightful remarks. We will now hear from Mr. John Denton, Secretary General, International Chamber of Commerce, to share his perspectives on how regional cooperation and integration could help reduce current inequities in access to essential health products, and specifically the role of the business community and organizations such as ICC in this regard. Mr. Denton, the floor is yours.
Thank you very much, and it's great to be on this panel. I'd like to begin by thanking Amida, the Executive Secretary of ESCAP, for the opportunity to speak today. In fact, Amida, I just realized that I don't think we've ever actually spoken one-on-one, so I'm going to ask my office to reach out, because I think it is important that we work as closely as possible, because particularly given the range of issues we're involved with. It's the ICC in Asia Pacific and Indo-Pacific, as it's now called in other circles. And as you know, we are the World Business Organization, the voice of the real economy, the institutional voice of more than 45 million businesses across the globe. We have a long history of cooperation with ESCAP and with the broader United Nations system. The ICC is the only private sector organization with UN observer status, and we actually have missions in New York, where I was last week, and Geneva, where I was yesterday. I'm coming at you from our headquarters in Paris today. We are the primary business interlocutor at the World Trade Organization, and I was with Dr. Ngozi yesterday, and the night before I was in discussions on TRIPS, the very point that was being discussed before by the WHO rep. I am also the private sector representative on the ACT Accelerator Facilitation Council, which has been talked about a little bit so far in this discussion, which is the multilateral effort designed to speed the production, distribution and delivery of essential medical products and services to combat the pandemic. By the way, I'm also extremely worried about the availability of diagnostics at the moment, and that's something we're going to be discussing, hopefully with the WHO, but also with the G20 leader in Indonesia this year, because more work needs to be done on how we actually live with the virus as well. And as of today, I will commence my work as the private sector, the only private sector representative on the UN Secretary General's Global Crisis Response Task Force team on food, energy and finance. What that's doing, and the first meeting is tonight, is working to mitigate the economic effects of the pandemic and the war in Ukraine on developing countries. This is an issue very close to our heart at the ICC, as more than 2/3 of our constituency is actually from the developing and emerging economies. So while our presence is obviously very global, we also have a very strong focus on delivering a regional impact. In addition to our work with ESCAP, we work very closely with ASEAN. It's so good to see Satvinder on the call. Work very closely with APEC. In fact, I was the former chair of the Finance and Economic Working Group there, and I'm deeply involved in developing what's called the Asia Pacific Financial Forum to deepen capital markets and enable access to infrastructure development. We work well with the Asian Development Bank, the Asian Infrastructure Investment Bank, and of course, as I mentioned before, with the G20 under the Indonesian presidency, including on trade and health. And both those areas, we're pushing for initiatives by the G20 presidency under President Jokowi this year. We have very active ICC presences in almost every country in the regions. We have national committees, they're called, the ICC national committees, in almost all countries in the region, promoting trade, investment and good public policy settings, but also enabling and pushing very hard for a speedy end to the pandemic and combating vaccine nationalism. And we've recently signed a historic memorandum of understanding with the Confederation of Asia Pacific Chambers of Commerce and Industry to deepen our engagement with the Chambers network across the region. So we're actually everywhere. I might just say to our friend from Tuvalu who was speaking, they were actively in the process of planning to create an ICC Centre of Entrepreneurship in the South Pacific, and we welcome the opportunity to speak with you, because our aim is to help develop the private sector as effectively as possible. And the form of development we see as good development deeply involves engagement with the private sector. So therefore, strengthening the private sector is key to our mission. So just before delving into the specifics of trade and essential health products, I think we've got to look at the broader context in which we're operating, because ultimately we need to get trade policy right generally if we're going to accelerate trade in medical goods specifically. So there are three important points I want to make up front. First, we actually put out a report in March, the ICC report on recent trends in trade and trade finance. And what it said was the COVID pandemic had disrupted supply chains on both the supply and demand side. These must be dealt with if we're going to provide access to essential health products. Because as economies reopened and lockdown measures eased, demand for goods and commodities quickly rebounded in Q2 2020. But this was creating tensions on global supply chains, and I think we all felt that. At the same time, operational disruptions induced by lockdowns, port closures, weak logistics infrastructure, and lack of trucking capacity all hampered shipping capacity and worsened the stress on supply. Together, this led to rising shipping rates and made all trade, including in health products, more expensive everywhere, which of course hit SMEs particularly hard. And of course, SMEs are the largest constituency in the business fabric of Asia Pacific. The second contextual point, which we cannot ignore, is Russia's illegal invasion of Ukraine. This is having a major global economic ramification, including for trade. And as you understand from my earlier comments, the ICC, we are particularly involved because we are present both in Ukraine and Russia, but importantly, we're also present in all the peripheral or littoral states. And the humanitarian crisis is affecting the constituency of ICC because it affects the communities there. Already, we've seen that the war has disrupted wheat supply, created higher energy prices and quickened inflation. And the war could well lead to the potential fracturing of the global economy along geopolitical lines. We cannot ignore this reality. Sanctions, whilst necessary to impose costs on Russia and attempt to bring about an end to the war, have also created unintended consequences for value chains the world over. From banana exporters in Ecuador to tea exporters in Sri Lanka to urea importers in Brazil, we have seen many examples of small businesses and sometimes entire value chains severely disrupted by the effects of sanctions. This is not to contest the need for sanctions, to change the behaviour, to punish the behaviour and to stop the behaviour of Russia. Rather, it's a call for the major global international financial institutes and regional financial institutes to actually do something about it. It's important that the World Bank, the IMF and regional development banks like the ADB step in and step up and support the countries to enable that are affected by this where small businesses lie. We've got to step in, step up and ensure that we've got lines of credit available to support small businesses which are being hurt by the ongoing crisis. If you want global solidarity in the campaign to stop this illegal invasion, then you have to remove the barriers to enable that, and some of those are economic. The third and final contextual point to make is that our global response both to the pandemic and its associated trade implications, frankly, has been lacking. The private sector has, through extraordinary innovation, developed vaccines, treatments, tests and medical equipment in record time and managed to deliver them to almost every part of the world despite trying circumstances. But our ability to do this has been hampered in many cases by short-sighted government policies. At the start of the pandemic, we saw export bans, hoarding and other restrictive measures greatly compromising our collective ability to stamp out COVID. And today, while many of the worst policy settings have been removed, we still have not managed to come up with a global framework for facilitating trade in essential medical supplies. At the WTO, the Trade and Health Statement has yet to be adopted, and much oxygen has been taken up by the proposal to waive patents with respect to vaccines, when governments would be much better off focusing on scaling vaccine production capacity globally. These 3 points, disrupted supply chains, economic malaise exacerbated by the war in Ukraine, and a lackluster multilateral response, all point to the need for greater unilateral and regional trade action, including in the Asia Pacific. This should embrace, and I'll describe this in three points. First, there's a critical need to maintain generally open trade settings. Governments must avoid taking any measures that limit trade in inputs necessary for vaccines and therapeutics production or supply, especially to COVAX, and unilaterally remove any such measures as a matter of urgency. Governments must accelerate adoption of the WTO's Trade Facilitation Agreement. This should go without saying, but it has to be said. And they should make trade smoother by simplifying trade processes and enabling paperless trade. including through the widespread adoption of the UNCITRAL model law on electronic transactions. And I've got to say, it's fantastic to have Satvinder here because he is a champion of this cause as well. The digitisation enabling digital goods to flow through digital processes which are actually effective. Second, Asia-Pacific governments in the region must support global trade and health efforts. Governments should support the Trade and Health Initiative at the WTO, which outlines specific actions relating to export restrictions, trade facilitation, technical regulations, tariffs and transparency, and review exercises that reflect emerging best practice. And critically, they must finally fully fund the ACT Accelerator, which still suffers from a major funding shortfall to the tune of billions of dollars, and yet remains our best exit strategy from the pandemic. And there are simply more governments in the Asia Pacific that should be doing more, and they know they should be doing more, and yet they still have not done so. So I call on them now to step up and not just use rhetoric, but to deliver the cash to enable COVAX to be fully funded and bring this pandemic to an end. Finally, despite our intuitive understanding of the trade problems, there is a crying need to improve our real-time understanding of evolving challenges in medical supply chains. We just have to be able to get much more reliable data about bottlenecks so that we can collectively take relevant and informed actions at the right time in the right place. At present, no international organisation monitors global supply chains, and there is no forum where international organisations, medical good manufacturers, key governments can meet to discuss pressing challenges and identify pragmatic solutions to pain points in global supply chains in a timely manner. That's why we have been calling at the ICC for the creation of a global health market information system or a supply chain watchtower. Its purpose would be to give greater visibility over essential medical supply chains, enhance cooperation between the public and private sectors, improve management of possible scarcity and bottlenecks, increase trade facilitation measures, improve resilience of relevant supply chains, and support the production, distribution, and access to relevant medical supplies. We've been advocating for such a mechanism at the global level, but if this cannot be done, then let's do it at the Asia-Pacific level. Let's do it through APEC. To sum up, today's conference comes at a very important time. This pandemic is not over. As I said before, we also need to learn to live with COVID, which is why we're also flicking our focus onto diagnostics to ensure that they're readily available and accessible. While the news has moved on and the war in Ukraine has only exacerbated our economic challenges, we must continue to fight this pandemic through smart trade policy. We at ICC applaud UN ESCAP for convening this conference, and we hope that the public and private sectors participating today can help speed and end the COVID-19 pandemic and help us learn to live with it, and importantly, build a stronger set of systems for dealing with future health crises. Let's keep our eye on the present and our focus on the future at the same time. Thank you very much for the opportunity to speak to you today.
Thank you, Mr. Denton, for your remarks and for highlighting the private sector perspective. We have now come to the end of the high-level segment and will move to the panel discussion. We would welcome the speakers of the opening segment to remain online and join us at the end of the panel discussion. It is now my pleasure to briefly introduce our distinguished panelists. They are indeed experts in their field. Their CVs will be shown on the chat as I provide a short introduction. Our first panelist is Dr. Valerie Ulep, Senior Research Fellow, Philippine Institute for Development Studies. Our second panelist is Ms. Asha Menon, VP Customs Compliance and Regulatory Affairs, DHL Global. She will be followed by Mr. Mark Rickinson, Director Life Sciences and Healthcare, DHL Global. And our fourth panelist will be Ms. Suchitra Ella, Joint Managing Director, Bharat Biotech International Limited. To start the discussions, I'd like to turn to Dr. Valerie Ulep. So Dr. Ulep, what were the challenges faced by the Philippines in accessing essential health products during this pandemic, and what actions were taken?
Thank you so much, Rupa. So hi, everyone. So pleasure to be here. So I would like to thank ESCAP, UNESCAP for the invitation to speak, right? To answer your question, this is a very hard to describe, right? But I would divide the challenges into two: supply and demand. So there are unique challenges in therapeutics. So I will try to concentrate our experience in vaccine access, right? So in terms of supply side, one of the major challenges that the Philippines faced, especially during the first quarter of 2021, was the limited availability and predictability of supply, which is actually a common challenge experienced in many developing countries. So, for example, when you look at our data, the supply of vaccine was unstable and very limited until the third quarter of 2021, right? So we receive a few, million of Sinovac vaccine donated by the Chinese government, then 1 million dose of AstraZeneca, then Sinopharm, followed by the Western vaccine, namely Pfizer and Moderna. So during the first months of the vaccine rollout vaccine was indeed a precious commodity. Like every single vial really counts, right? So, but now, vaccine supply is now relatively stable. So we have secured around 200 million doses for a country of 100 million population, right? About 50% of our vaccine supply came from COVAX, and the rest are from bilateral agreements or from bilateral donation, right? But given the expected tight and unpredictable supply during the initial phase of the rollout, the government's strategy was to at least achieve some semblance of stability of supply through, they call it the portfolio approach. So if you think about this, we did not prefer a particular brand, right? And I think we are the only few countries who approve almost brands of COVID-19 vaccines available in the market, right? So we have Chinese vaccine, we have Indian vaccine, Western, Russian vaccine approved by our Philippine FDA. So name it and we have it, right? Of course, this portfolio approach has implication in terms of demand generation and how vaccines are promoted. So the Ministry of Health adopted this brand agnosticism strategy, right? So the narrative of the Ministry of Health is that all vaccines are equal and that all Filipinos should take it regardless of country of origin. There's our challenges in this strategy, but this is the only way we can actually get a stable supply, right? Another level is that even if enough vaccine doses are eventually made available through different channels that I've mentioned, successful rollout was still constrained by the perennial challenges in the health system, right? These challenges, range from the lack of trained medical personnel and inadequate health infrastructure, including supply chain and logistics, right? Which is a common problem, right? So the bigger question now that we need to think about is, as COVID-19 vaccination becomes part of existing public health, programs like TB or HIV, how do we augment our existing health system and institution so COVID-19 vaccines and other public health programs are accessed equitably, right? So, and my last point in terms of demand side is, I think the major challenge for the country was vaccine hesitancy, which is common also in many countries. So before the campaign, remember that only 32% of Filipinos wanted to be vaccinated, but now more than 90% have already been vaccinated or they're willing to be vaccinated. If you look at the history in the Philippines, we have this baggage because of many controversies related to vaccine, right? So, and I think during this time, we were able to turn this around through strategic communication and more scientific understanding of how the demand is actually behaving, right? So based on survey, for example, leaders and health providers are the most trusted in terms of vaccine, right? Information. So the approach of the ministry is to actually talk directly to physicians and healthcare provider through town hall meetings and very intimate discussion so that it will trickle down to the population, right? And there were also extensive training of media personnel, right, on how to report adverse events, right? And there were also an excellent interface with the public-private sector on how to actually combat vaccine hesitancy. So there are a lot of challenges, but I think these are, I would say, the biggest challenges that the country and how we actually overcame them. So,
thank you, Dr. Yulep. Now I'd like to turn to Ms. Asha Menon. I would like to ask you, what are the customs and regulatory compliance related challenges that have been highlighted by the pandemic?
Thank you, Ms. Rupa. Good morning, good afternoon, and good evening to everyone. First of all, on behalf of DHL Express, I would like to thank Union ESCAP for giving my colleague and I the opportunity to be part of this event. Before I answer your question, please allow me to give a brief info about DHL Express, the idea of our reach for our presence today. We are present in 220 countries and territories. We have 120 employees, but of which 15,000 is dedicated specifically to customs clearance. And we clear more than 200 million shipments with customs a year for approximately 3 million customers. And lastly, talking about vaccination, we have distributed more than 2 billion vaccinations globally already. Next, please. Coming back to your question, I believe in my response, you will find not many new things, but probably the same challenges we have been having all along, even before the pandemic. But it has been emphasized more, you will see, during this pandemic. So the first one, we see some countries are more prepared than others for customs and regulatory changes. We saw one of the challenges we saw is new regulatory changes coming into play, which was necessary for sure in the circumstances, but many were done in a hurry without much notice or engagement with industry and understanding the true situation on the ground. That led to many interpretation and misunderstanding, definitely at operational level, which you hear from my colleague later. This has led to serious delays and uncertainties. So we understand the pressure the regulators were under, but due to this, it has caused more hardship to a lot of traders, especially, we can say, on our half, DHL. Having said that, it has definitely got better, but this could be avoided in the future. Like, for example, we've seen some regulation restricting exportation of supplies of ancillary supplies that resonate with what we heard from Mr. Nicolasi Apinelu said just now. Other challenges we see is while the vaccine were giving simplified clearance, many countries, the handling of ancillary supplies, which is equally important, were not considered in the same way for simplified clearance. This is lack of cooperation between relevant agencies, government protecting stocks of PPE, and later ensuring high duties. For ancillary supplies, the challenge is in early days, it showed lack of cooperation between relevant agency, causing clearance delay and import-export control measures on medical products, such as masks and hand sanitizers. Especially the import-export controls measures attributed to government protecting their country and to ensure the high quality of these ancillary supplies entering their market. Now we see clearance or import and export processing delays now. So now we would see that there is no shipments that did not clear customs on time due to regulatory hurdles as a result. Shipment to state warehouses. So if the shipments are not cleared, they are sent to state houses for uncleared goods or for disposal. So two issues we identified as reasons for this failed clearance. One is necessary provision of required importation certificate needed. And second, delays in obtaining regulatory approvals, highlighting the lack of interdepartment cooperation or non-payment of import or VAT duties, indicating missing duties or tax and free regime for those products. And lastly, customs and regulatory agents cannot work in isolation. So, and like I think we heard from the other speakers here, lack of digitalization in many countries, insisting on hard copy documentation, non-electronic payment, especially in an environment where there are challenges at the border with high cases and not many front officers are allowed to work. The border definitely did not help the situation in getting our goods cleared. Thank you.
Thank you very much, Ms. Menon. Now I'd like to turn to Mr. Mark Rickinson. The question to you is, what are the critical transport and logistics related issues that have been highlighted by the pandemic when it comes to global transportation of vaccines and other health products in such emergency situations?
Thank you, Ms. Rupa. And I'll echo the sentiment from my colleague there. Many thanks for ESCAP for inviting us to share our observations with you today. So to answer that question, looking back at how this pandemic has evolved and what some of the challenges were that logistics planners faced, with a clear objective, obviously, to move the vaccines or medical supplies as rapidly as possible into the markets and ultimately to the points of use in the field. That planning not only had to consider the physical movement of the goods, but clearance, as my colleague has mentioned, where there's variety of approaches, and other operational requirements, which has been mentioned on this call before, an example being maintaining the vaccine stability through the temperature control conditions. And in itself, that brings other dimensions that need to be considered by transport planners in terms of dangerous goods, if indeed dry ice is being used, the utilization of active data loggers, each of which need to be approved by the airlines that would be carrying the goods, and of course different packaging standards that are being used by different providers, each with their own validity period and time frame. So you have a relatively complex criteria to consider. You have high volumes to move, and ultimately, it needs to be moved with speed to enable the rapid transit time that's required to maintain the stability of the goods. And ultimately, that means that much of that international transportation, as we've seen in Asia as well, means that you'll be moving the goods via air carriers. But as we know, this was a rapidly evolving situation in the aviation industry, lockdowns and travel restrictions being imposed, freedom of movement being isolated, and ultimately less commercial airliners flying around. So on a global level and also a regional level, a big volume to move in short period of time, but a situation where your air capacity on a commercial level is reducing down to very small levels. And that naturally has a implication that had to be considered and was a challenge for logistics planners. It means really you have a shift of volume from what would be passenger belly cargo space into dedicated freighter operations or express networks such as DHL. Obviously, with a very strong fleet, DHL was well positioned to support the vaccine distribution, as my colleague mentioned, over 2 billion doses so far. But with that reduction of commercial air flying, it does have an impact in terms of your flexibility, your contingency options that you may use traditionally, and other details such as positioning your air crews into the right place to maintain their schedules and sectors. Again, further challenges that the planners need to deal with. And to exacerbate the situation, of course, we saw a landscape which was rapidly changing. Authorities introducing different levels of severity in terms of crew movement, schedule, consistency, frequency change, and indeed last-minute flight cancellations. So these seemingly are obvious knock-on implications of the travel restrictions that we all observe to be imposed, but you can understand hopefully the challenge of the planner, ideally looking for a stable platform to produce a plan that will effectively deliver the vaccines into countries. And so we see this as a potential opportunity for further regional cooperation. One, how to maintain a certain level of consistent air capacity, particularly into more challenging or more remote locations, and how can that be preserved for those supplies? And in parallel, I think the common theme that we're hearing is how can we continue to further harmonize the standards when it comes to import, when it comes to flight crew restrictions, for example, anything that's going to make the planners work easier to work with a more stable platform is going to help them support the markets to develop a more optimized distribution capability. Thank you.
Thank you, Mr. Rickenson. Now we move to our final panelist, Ms. Suchitra Ella, who I should congratulate because she has recently won the third highest civilian award, the Padma Bhushan from the Government of India, for her contribution to public health. Ms. Ella, we'd like you to share the experience of Bharat Biotech with the production of Covaxin, in particular issues concerning the indigenization of R&D and scaling up of production capacity. What are the lessons that can be drawn by other potential manufacturers of vaccines and aspirant countries?
Good morning, good afternoon, and I don't know if I hope it's not good evening, but thank you very much for this invitation, and I thank ESCAP for putting together this very important topic of discussion and bringing all eminent panelists on a single platform to discuss the issues that we as a world collectively have faced over the last 2.5 years now. I would just like to introduce myself very briefly, my organization. Just to mention here that Bharat Biotech, I'm a first generation entrepreneur. My husband and I relocated back to India in the mid 90s from the United States, and established a biotech company in India to develop indigenous technology platforms, processes, manufacturing, R&D, and all the other related aspects of vaccine development and biotherapeutic molecules in this part of the world, because India is still getting out of the developing country mode. But we needed this back then. It was even more relevant that processes had to be in place and product development had to be put in place at a very large scale in manufacturing terms, when I'm talking about millions and billions of doses of vaccines to be done. So we came back with that vision, and the mission was to establish such capabilities for the country and for this part of the world where the population is a challenge, and also the regional disease burdens, the infectious diseases that also play a very important role in the socio-economic scenarios of all our countries in Asia and in many middle-income countries and the other low-income countries across the world as well. So that was the intention. We serve as an evidence and as a model of innovation and product development in such low resource settings. We have demonstrated these attributes through our innovation-driven vaccines for rotavirus, typhoid conjugate, the COVID-19 vaccine. And additionally, we are also developing vaccines against cholera, malaria, chikungunya, Zika, and paratyphoid, and the non-typhoidal salmonella, which is a major issue in the African nations. Most of these vaccines are highly important, as I mentioned earlier, for all the MICs and the LICs, the countries of the world, and including India. Some of them are also very region specific. Having said that, to this day, Bharat Biotech has manufactured and supplied to more than 120 countries across the world. We are also a major technology builder, believe in strong intellectual property and also technology inputs that need to be built, because vaccines involve process technologies and process platforms. It is not a product patent that we come under, but we have process patents which are used and deployed in many of the aspects of building a vaccine as a final product. And we have supplied more than 7 billion doses of vaccines worldwide. We have, of course, contributed to many of the large international universal procurement agencies from UNICEF and the other many foundations that do procure vaccines in large volumes for many of the countries of the world. Coming to Covaxin, which was something that took us all by the back foot. I don't think any one of us was prepared, though we did have some little inferences of the SARS traveling around 5-7 years back in certain parts of the world, and also in the form of swine flu, the H1N1 pandemic, which was also there a good decade or so ago. But I think when time moves on, things are sometimes put on the back burner, and none of us probably were prepared for facing a pandemic of this magnitude. We chose the classical route of developing a vaccine because of our strength and capabilities that existed in building viral vaccines, production and development of viral vaccines that we had done in the past. We chose this classical route of vaccine, which is called live attenuated virus, which was deployed. The entire SARS-CoV-2 virus was deployed in this process technology, and it was then formulated as a vaccine candidate, tested in animals, in small animals, and then also deployed for human testing. We underwent the entire cycle of product development in the pandemic during its wave 1 and wave 2. This almost took us 9 to 12 months, I would say almost a year, by the time our interim results were announced in March 2021 with 78% efficacy. The most important thing was that it is a safe, proven, classical method of development of vaccines. At that point of time, India probably did not have access to the mRNA vaccine, mRNA technology platforms that was available elsewhere in the world. But India has been very strong in terms of recombinant vaccine development and the viral vaccine development, as I had also earlier mentioned. Logistics and supply chain has been a huge challenge. We all know what happened to all of us during the first wave and the second wave. Most of our supplies and many of our process supplies come from Europe and the United States. Many of the nations had also had gone into their pandemic laws, and the emergency acts were deployed and the defense acts were brought in. So some of our supplies and raw materials, which are dependent on EU and US, had some initial timeframes when there were challenges to overcome. The pandemic also brought the issue of adjuvants. Adjuvants are also, again, process technologies which are controlled by different groups of people across the world, institutions or countries for that matter, largely sometimes private or public institutions, because research happens at all levels in such platforms. So we collaborate with many institutions from across the world. So that was something that also we had to overcome. Clinical trials. I think the first time in Indian pharmaceutical vaccine development history, in a pandemic, coupled with a pandemic, our clinical trial program, the human trials, ran close to 28,000 subjects who were enrolled in it across the country in 25 sites all over the country in multiple medical institutions, and all the phases from phase 1 to 3 were conducted, evaluated, processed. Data management had to be done. An international organization called IQVIA was involved in it, formerly Quintiles. Brought into this. It was, a humongous amount of data that had to be processed and put together, and also be very confidentially held and finally submitted to the National Regulatory Authority before licensure. So clinical trials itself during the first 2 waves has been an enormous challenge in terms of mobilizing the kind of volunteers that are needed, that had to be screened in order to get to a number of our control number that was required for the trial itself. And you know the logistics issues in terms of even local transportation and personal transportation that existed for many of these volunteers to get to these sites and so on and so forth, and all the issues that were also going around all of us globally in terms of what the pandemic is all about, and should they even participate in trials or not participate in the trials, and all those, you know, challenges of human emotional challenges that also have to be kept in mind. We collaborated with NIV Pune, with the National Institute of Virology. They did large animal trials for us, which was a very important step in order to prove that safety of this vaccine was primary and most important for us. And this was achieved excellently well, because Covaxin today has more than 12 publications in international journals which have been peer-reviewed and accepted and published world over. So this is a great step in terms of the R&D and the clinical development of a new product and a new vaccine, especially for a pandemic. Regulatory bottlenecks have always been there. We have overcome it. We have worked closely with the Ministry of Health, the National Regulatory Authority. Our own testing cycles are there, which cannot be shortened, but have been compressed, fast-tracked. They have been fast-tracked in order to help us get to fastening the supply of the vaccines.
Thank you.
Thank you.
Ms.
So
Ella?
we have now closed. I will just say this last line.
Sure.
We completed supplying close to 350 million doses of Covaxin to the entire country in India. Some percentage of it, a little percentage of it also was dispatched overseas under the Vaccine Maitri. That was an initiative of the government of India, where vaccines were sent from India to many other countries that also required these life-saving interventions. Thank you very much.
Thank you very much. We will certainly come back to you in the second round. I turn again to Dr. Ulep. So do you see a role for regional cooperation in enhancing equitable access to essential health products in terms of promoting R&D and participation in global or regional value chains? And how can countries in the region, including yours, work together to strengthen investment, financing, fiscal measures towards this goal?
Okay, sure. Sir, thank you for that question. I think before I provide my insights on that, perhaps let's start with the problem, right? So the problem stems from the fact that, you know, that global research is fragmented, highly uncoordinated, and in most cases under-resourced, especially in developing countries. And this adds, you know, and the problem of the lack of capacity of many countries to manufacture and distribute devices, drugs, and other life-saving commodities, right, to all countries, right? So the question is how, you know, regional cooperation could facilitate the whole process. That is from research and development and in upscaling manufacturing, right? And I believe throughout the process, you know, regional cooperation could be instrumental to facilitate financing, delivery, and governance during these phases, research and development, actual manufacturing of the product, and even the readiness of the health system to deliver these life-saving commodities to local communities, right? So I know many have put forward the possible roles of regional cooperation, but I would identify two governance and regulatory areas in which, you know, regional cooperation could be useful. I cannot name all of them. So, you know, at the R&D level, right, delivery of COVID-19 vaccine might have happened faster if there have been, you know, close coordination of clinical trials, right, and more incentives for coordination. So, in other words, greater, you know, harmonization of, you know, clinical trial regulation, right? And we've noticed this in the Philippines. So, note that, you know, many clinical trials on vaccine and drugs are, you know, conducted domestically in many health institutions, like in India, in other Asian countries. They only need to address, in that instance, right, they only need to address the regulatory agency of that particular country, right? But in reality, typically this study is not robust enough to validate results, right? So hence, there is a need to conduct international trials to provide more diversity in the analysis, right? So a clear example of this is the Solidarity trial. So while efforts in many countries of the clinical trial regulatory authorities to streamline all these procedures, there's still urgent need to harmonize all these regulatory requirements and processes, in addition to the challenges presented by the existing regulatory complexity, right? Clinical trials have to respond to the administrative requirements, right, of many countries that are always adopted for that particular study. So that's for the R&D. And in terms of manufacturing, a lot of conversation now, discussion on how to expand, vaccine manufacturing capacity in developing countries. We've heard about, the importance of technology transfer, et cetera, right? However, for low middle income countries to manufacture a product at par with global standards, we need to start thinking about, the quality of regulatory agencies, right? So unfortunately, when you look at, for example, the data of WHO, like one of 3 countries in the world only have the capacity to effectively regulate medical products in their countries, right? So expanding, when we try to expand vaccine manufacturing without guaranteeing adequate regulatory capacity of our NRAs or our FDAs, will have a huge repercussions on the quality and safety of the product, and therefore it will have huge implication on public trust. So, expanding, when we discussing about, COVID vaccine manufacturing, and building a sustainable global and regional network in vaccine manufacturing, we always need to think about the capacity and the functionality of NRAs, right, in regulating these activities. So I guess when we, as global health advocates, they need to be a robust plan on how to actually build capacity of many countries, of NRAs in many countries. So given the limited time, those are the 2 things that comes into my mind when we talk about R&D and the role of, R&D and the role of regional cooperation.
Thank you so much, Dr. Ulep. Since, yes, we are a bit beyond our time frame, so I would request the following speakers to be brief and quick with their responses. I would like to turn to Ms. Asha Menon. So what changes are needed in the way private sector logistics operators such as DHL and governments work together to ensure compliance with regulatory standards and processes for essential health products? And once again, how can regional processes promote such public-private cooperation?
Thank you, Ms. Rupa, and I'll try to be short. So, I'll try to give as much just points. I think a lot of things that I'm going to say has already been discussed and talked around in a lot of international forums. And I think is the part where I think we need to get it moving. One very important thing that we heard again from the ASEAN Deputy DG and the ICC Secretary General, they talk about digitalization. So I think digitalization is very important. If you're talking about bottlenecks at the border, at the clearance, we need digitalization. We need customs and regulatory regulators to actually go into digitalization, whether we call it paperless, borderless, invisible government, whatever we call it. We need single data transmission. We can do like what the Deputy Secretary General of ASEAN said, advanced goods arrival, pre-arrival. DHL has a lot of data, and we have data in advance. We are very happy to share the data with regulators if regulators could see digitalization moving forward. And this is something for all health products, right? That is one way to make sure that we get the stuff moving very quickly, other than, of course, because we're talking strictly customs and regulatory, this is something that we see really that we can move forward. We think that regionally, we could look at fostering regional collaboration. I think we've heard that also. Regional collaboration and international collaboration. A lot have been done. Yes, very good. A lot of MOUs has been signed. A lot of things that have been done internationally. But I think that has to trickle down to national level. So maybe the regional cooperation can put a bit pressure on how to make sure that it is implemented, right, at the national level to move forward. So now, because we've been talking a lot of having all these things, we need harmonized, standardized border procedures, whether it's national, regional, or global. And if you ask a lot of international organizations, WHO, WTO, WCO, they say, yes, we recommend, we ask to do this, but where are we moving forward? Has it been done? No. When are we going to do this? Maybe you could look at in having a regional regulatory framework specifically for emergency situation. I'm not sure if it's done, but I think it's very good to have one for very specific products. So we know in the future, now we have the pandemic, what might happen again. Maybe we have a regulatory framework for emergency situation. Another thing is trade recovery regime. I'm sure you must have heard it a lot about trade recovery regime, but can we have a regional trade recovery regime? Okay, because this is what we need, because this is what's happening around. We need to have a regime or how to recover from this kind of pandemic, especially, for the industry. Also humanitarian relief. The pandemic has made it clear that many governments did not have specific regulation and procedures in place to define essential goods and services, nor clear critical shipment to quickly for government and international organization to engage with the private sector and to plan ahead how to make this sure that critical relief shipments can move quickly when the crisis hit. So that's another thing that we looked at should happen, and it could happen even at the regional level. Now, just very quickly, what we have done in for us is that we have followed the pandemic. We had developed stringent, robust SOP to cater for all these 220 countries and territories operating in order to continue providing our services. And we've also developed a global customs compliance program around the world to ensure, especially the products, essential medical products that are moving around the world are not IPR related. So we have come up with a global compliance for all 220 countries and territories to make sure that ensure that we do. And lastly, sorry, very quickly, we are always open to have any kind of engagement with whether it's international, global, or national regulators on how we could work together, how DHL can, in our way, assist in any way. Even pilots, open discussion. So we are very happy to have it. Thank you very much for giving us this opportunity.
Thank you, Ms. Menon. I'd now like to turn to Mr. Rickenson. Beyond the challenges to vaccine distribution, which you described earlier, what observations have you made between the approach of different countries to vaccine distribution? And again, could regional cooperation help in streamlining supply and improving access?
Thank you once again. So, yeah, I fully believe that any form of cooperation at a regional level, alignment, we're hearing the words standards, harmonization, preparedness over and over, and anything that can be achieved in this space, as my colleague said, would naturally help that access, because you're giving the transportation and logistics providers more of a stable and consistent landscape to work with. As Asha highlighted earlier, DHL has now successfully moved over 2 billion, actually 2.3 billion doses of the vaccine to 175 countries in all continents. So we've had opportunity to observe many different approaches and models and varying degrees of government involvement from country to country. And typically, we see variation coming in clearance procedures, as my colleague mentioned. Just to touch on it, varied approaches, some adopting a much more streamlined and efficient process versus normal as a best practice, others continuing on with the regular approach. Other areas include security, or indeed, to some countries, military involvement, which again has to be considered from the planner's perspective to ensure that whatever scheduling, sequencing and distribution plan also considers the requirements of the country from a security context. And what we observed is that involvement was often quite reactive and highly ranging in extent from regular to full military escorts through the ground distribution, which is another factor that the planners then have to consider. Naturally, each country has their own assessment of risk, and that needs to be adopted. But we do see, just to call out, a distinct range of influence there. And it's been mentioned before, but remote, more challenging areas to get to geographically. We've seen various distribution models in practice through the different countries. Some even engaging, local, national, or indeed military carriers to support the distribution to some of these more challenging areas. Others obviously taking a different approach and depending on the transportation provider to do that final leg. And I think that also draws a focus onto, the talk of preparedness and the national carriers that operate, particularly to the more remote areas, which, through the pandemic and the travel restrictions that I mentioned, then start folding capacity, or indeed the frequency or the schedule consistency becomes impacted. So potentially this is another area for preparedness when looking at the opportunities in infrastructure to support that local distribution. What kind of aircraft, what kind of dry ice limits do they have? Are they approved to take the data loggers, etc., all items on a checklist? And whilst each of these emergency situations naturally will be somewhat different, again, I reiterate, I believe there is still a strong case for further regional cooperation on a number of topics that we've talked about to harmonise those standards, potentially develop playbooks or indeed blueprints as part of that preparedness model, and those founded off the lessons learned from this pandemic and can bring tangible access benefits for the future by streamlining that supply planning process. Thank you.
Thank you very much, Mr. Rickinson. I would now like to turn to Ms. Ella. Can you share your ideas on how governments can address financing, R&D, regulatory approval-related challenges, and other issues faced by vaccine manufacturers? And once again, how regional cooperation could play a role in this regard. Also, I'd like to seek your views on the Global mRNA Vaccine Technology Transfer Hub and its prospects in Asia.
Relating to this question that you have just very aptly asked, I think the pandemic has taught us not one, but many lessons have been learned in many aspects, and certainly in terms of cooperation and establishment of new initiatives, which is not just merely concentrated in certain parts of the world, but it should, with a reach and connect with many other regions of the world as well. Several of the issues related to vaccines have to be deliberated. And we should also develop detailed strategies for the development, manufacture, and distribution of all essential health products, and especially vaccines during pandemics. This could be a global commitment by all countries that have to be adhered or followed and taken into perspective when we are facing such situations globally. We should capitalize and fund new manufacturing facilities across the world, especially in LICs and lower middle income countries, specifically designed for vaccine development and manufacturing, and a wide variety of platform technologies. As I had mentioned earlier, platform technologies are a very major component of putting the final vaccine together. though it is a protein or it is a virus or it is a bacteria in nature, the antigen is like that. But the constituents of that liquid in that vial constitutes many other components where such knowledge and such expertise is available globally and not in a particular country at a given point of time. I think companies with vaccine manufacturing expertise should also be involved in this, because maintaining these facilities become very important. For a pandemic vaccine, we look at billions of doses of vaccines that are required. But for normal immunization, when you look at the children, the birth cohort of a country, for the children vaccination and for the adult travelers vaccination, billions may not be required. It is normally in the millions of doses, depending on the size of the population of the birth cohort of that country and the disease burden itself of that particular region. So vaccine manufacturers would have a huge role in order to maintain these facilities, because they are all, they run 24/7. They're controlled by HVAC systems and they're temperature controlled, and all kinds of GMP regulations and restrictions and guidelines have to be adhered. And you just can't shut down the facility after a pandemic. So we have to bring in a sustainable model in terms of plugging in region-specific vaccines that could also be maybe developed, manufactured in using the same facilities without recreating newer infrastructure and investments in the future. CEPI has recently initiated an RFP towards such an initiative. Early on in future pandemics, innovators should be provided development funding and also be enabled with partnering with large-scale manufacturers, because normally vaccine technologies start off in laboratories, in universities, or in public sector institutions, or in private companies, R&D-based companies. Later on, these technologies then get transferred to the large manufacturing scaling up of volumes, and the manufacturers are different. The technology builders can be different. In our case, we happen to be the same, but in many examples we can cite, they are always assimilated and put together and then rolled forward. This will enable earlier start of technology transfers and also give a process and increase the availability of vaccines. Development funding to companies should be based on the company's ability to manufacture vaccines at scale and in the right time frame and with right partnerships. Target product profile for pandemic vaccines to be clearly defined for the future, well before a pandemic is expected or may come around, especially because dosage, the quantity of the vaccine to be given, number of doses to be administered, storage conditions. Most vaccines are 2 to 8. In our case, it's a 2 to 8 vaccine, but we also make polio and rotavirus, which is -20. And we know that the mRNA vaccines are -70. So there's different vaccine technologies products are going to have different distribution requirements. Coming to the mRNA, I would not want to take too much time on it, because we personally we as an organization have not worked on it yet, though we maybe in the future sometime we will also get into it, because we are in recombinant technologies as well. We have vaccines from similar other areas as well. But the mRNA vaccine technology was something that was brought about in order to address a pandemic situation, which was very alarming for all of us. This has to be studied further deeply, because it's a very new technology, and also it's only available in certain parts of the world, especially the high-income countries and the developed nations. We don't know whether even the distribution and the logistics for -70 exists in many other parts of the world. The support of data is required for further enhancing this technology. mRNA vaccines did save lives in many cases, but we need detailed studies further to show long-term data on efficacy and side effects. which also should not be neglected because it's, after all, again, comes back to human life. The gesture of making a technology platform available to low and middle income countries definitely is very welcome. And I think it certainly addresses vaccine inequality. It is very important. We ourselves also continuously work with multiple countries and other manufacturers in the developing world, with the developing countries vaccine manufacturers network. We have many manufacturers which come from different parts of the world. So we do engage in processes and products being shared, and knowledge being shared and trained, and of course products being developed in that manner. We need to bring in qualified manufacturers and strict quality control, because this is something which is very important and it is irreversible, and it's human life ultimately. Cost should be an important deciding factor for any technology platform, because that is what makes it available to the common man and affordable to the common man. And I think the developing world, the LICs and the LMICs are all under this bracket. So we need to ensure that affordability, safety, and a quality product has to come out at the end of it to benefit public health at large. Thank you very much for this opportunity.
Thank you, Mrs. Ella. Excellencies, friends, we have come to the end of our 2 rounds of questions. Now we have around 20 minutes or so for an open discussion. So I'd like to take questions from our participants. Those wishing to ask a question or to make a comment could kindly send their question or comment using the chat function. For those on MS Teams, you may kindly use the raise hands function. Please keep your comments and questions short and focused so the discussion can be interactive. If you have longer interventions, you may want to just mail them to us or put them in the chat box. So let me start with a question that's come, which is, should Asia build stronger vaccine production capacity regionally? Would that help to improve pandemic response? And specifically to Ms. Ella, the question is, how does she evaluate the market for vaccines after the pandemic in Asia? So maybe for the regional production capacity, if there's anyone from the panel who would want to respond to this. Dr. Ulep? Hello? Dr. Val? Okay, Ms. Ella, let me ask you the question, since there's a specific question to you. How do you evaluate the market for vaccines after the pandemic in Asia?
I would, like I said earlier, we just cannot be focused on pandemic vaccines alone. We could look at certainly expanding the base of manufacturing many other vaccines that are required globally across the world. There are existing vaccine manufacturers in Asia, and Indonesia has a large manufacturer. We in India have at least close to about 5 to 6 large manufacturers. And there are other smaller groups across the Asia-Pac region. But I think what is important is also that we need to collaborate within each other, without which we as the Asia, ASEAN, or whatever we call it, I mean the larger Asia-Pac region, we need to be more collaborative to come together in terms of bridging those needs and gaps and the challenges and the requirements that we all have as countries. I think ultimately public health has to be benefited. It does not matter whether the border of the country or the the color of the flag. But I personally believe that we certainly can enhance our potential because we also are populated quite heavily in the Asia-Pac region with two of the largest populated countries from this part of the world, India and China being there. China has its own internal capabilities and resources to come up with their requirements. But certainly India is in a very good position. I think we have also demonstrated that collaboration with public-private partnerships and with private-private partnerships will definitely go a long way in establishing vaccine equity in the Asia region.
Thank you very much. Dr. Ulep, I come back to you. The question is, should Asia build stronger vaccine production capacity regionally? Would that
I was muted
yes,
a while.
I realized. So, yeah.
I think, of course, I think we need to actually build our capacity to produce vaccine. But I guess one of the most important thing to think about is like the elements of that production capacity from, how do we improve the capacity, for example, of our researchers, universities, for example. In the Philippines, you don't have that yet capacity, but our neighboring country like Vietnam would have it. Like our capacity of our local pharmaceutical and tolling companies, for example, they don't have even capacity to manufacture these vaccines. So I think these like single elements in the ecosystem needs to be identified and what kind of assistance and what kind of interventions needed for them to be stronger as we assemble this product, right? There are elements that needs to be strengthened along the way and that needs to be identified, right? So yeah, and for sure the answer is yes, we need to have that stronger capacity at the regional level. How do we exchange information, for example, between our researchers, our manufacturer, etc.? So there's need for a stronger coordination in that front.
Thank you. So let me turn to either Ms. Menon or Mr. Rickinson, anyone actually who would be interested in answering this question, but maybe we can start with Ms. Menon. Countries have dedicated a lot of resources in response to the pandemic, resulting in the speed with which we have seen areas such as vaccine development, approval, regulatory changes, etc., being implemented. Moving forward and taking it from your perspective, as from customs, for instance, how do we keep the momentum going in order to continue improving access? Do we see a risk of slowing progress, including in areas such as customs and regulatory improvements or trade facilitation, which could hamper access going ahead in future? Is it just a temporary sort of reaction that we are having to the pandemic, or we could see improvements going forward? And do you see that momentum?
Thank you for the question. I mean, from DHL, I think we see it too, depending on the country. So I think the momentum is good, but we have to maintain the momentum. And the only way, well, I think that momentum can be maintained is the pressure. Because there have been cases before, I think we've seen it in the world that, when there is no momentum and there is this lack of pressure, you tend to see a bit of lackadaisical, slowdown. And so that is something that we shouldn't do, even though now I think we all understand pandemic and, the importance. But, government has so many issues, or even customs. This is not the only one. So I think one thing that can be done is pressure to ensure that the momentum is continuous, and that pressure can come whether it's from sub-regional or regional or international, global organization, ensuring that this is something that has to be carried on and moving and making sure that it moves. And I think this is what we've been trying to do all this while. And I think we should take the opportunity, because now, like we said, the digitalization, I think, is one of the very important aspects that should be moving forward, because that will really help with all this clearance and movement of goods, which we really need at the borders. Thank you.
Thank you very much. In the same light, Mr. Rickinson, you mentioned about the various logistical and supply chain challenges and the transportation of these essential health products. Again, how does one keep the momentum growing? And what is the kind of role organizations like DHL could play in keeping this momentum, in putting this pressure that Ms. Menon mentioned?
Okay, so yeah, naturally, as I've talked about, and I think it's been mentioned a number of times, there is definitely opportunities to continue or accelerate based off what we've learned out of this pandemic situation. There's words that have been used time and time again in terms of standardization, harmonization, preparedness. So building on what my colleague has just mentioned there, that the importance of these kind of forums, informational sessions, pursuit with the countries, and where regional organizations are in conjunction with private companies that support in this field can add that that pressure and enable the countries to come together and see the benefits there of that standardization, that harmonization through from a regulatory, from a logistics, from a planning, from a preparedness perspective. It's really where we would like to see these kind of forums and organizations, agencies supporting more.
Thank you very much. Let me turn to, I think, Dr. Ulep once again. So,
Yes.
Given your expertise in the area of health systems, what do you think could be the mechanisms for governments, especially to incentivize efforts to increase R&D capacity? And if there are national resource and capacity limitations, what could regional mechanisms perhaps do instead?
So how about the incentives? I guess I think one of the countries should do is actually to really invest in research. Invest in universities, and actually that's one of the challenges in the Philippines, is that our investments in research and actually in higher education is actually very minimal. And now there is actually, or our investment, for example, in science and technology is actually very minimal. So I think there is actually a move now to actually increase our capacity. The capacity of our research institution to do these kinds of technology, right? So, and when we compare ourselves to our neighboring countries, it is actually very problematic, right? And at the regional level, I think it's important for us to keep discussing, like, in sharing information. I think that's one of the key important stepping stone, I would say, for this to happen, right? So number one is like really investment. The government needs to really invest in our research institutions and universities, and we haven't done that for many decades. And I'm sure this is also a challenge for many low and middle income countries, right? So yeah.
Okay, thank you. One final question, which is about the WTO TRIPS waiver, and whoever would like to answer this, Ms. Ella or Dr. Ulep, maybe. There's been a lot of discussion about a possible WTO TRIPS waiver to temporarily suspend IP protections governing COVID-related health products. But nothing has materialized so far. So do you see promising potential avenues for facilitating technology transfer? We talked about the technology transfer hub. What other such mechanisms could be there for facilitating technology transfer? Because that's at the heart of it, to increase production capacity, research capacity. And again, what role can regional cooperation play?
Certainly, there is a good need for countries, big and small, to be able to partner, come together, work together, and also make healthcare products accessible and affordable across regions, across continents, across countries. We work with multiple collaborators. Some of them are technology partners. For me, giving a transfer of technology maybe could be a few sheets of paper or a file or a certain number of pages of a document. But then internally, as I said, vaccines are inbuilt with many in-process technologies, which we as a manufacturer, we as a developer would have either partnered with somebody who have the rights, and they would have given us the rights to use their technology platform in a product that is being developed by us for that specific product. And it will not be a universal kind of an agreement which would exist between the tech partner and the manufacturing or the developing partner, unless everything is in-house, which is very rare. We normally work with multiple types of groups of people who have the expertise. It is not possible that one organization alone can bring everything to the table and offer it as a product. So we end up having legal binding agreements with tech partners who have given us that kind of process technologies. So it would be beneficial if the TRIPS agreements and international agreements of this order can cover all of it. It's not just about the manufacturer or the developer trying to release a tech transfer document to another organization or an institution, because with that, they probably would not be able to go too far. So we need to look at it at a very, very broad, universal, global kind of a scenario, and make it the ease of doing business with each other to be a little relaxed in terms of such situations. And then, of course, certainly everything will be open or available and usable by some other entity or institution that would like to take it forward. But infrastructure is important. Tech transfer is one thing. Infrastructure, building facilities also doesn't come cheap. One is the financial part of it, the resources that are required, but the time frame to build a facility. So we need to be also planning ahead in terms of that. Timelines are like 36, 48, 60 months for a moderate vaccine facility. I'm not talking very humongous facilities, but even for a moderate facility, I think timeframes in creating infrastructure should also be factored in. So it is a gamut of things. Governments should be talking together. I think institutions within the governments can be talking together and building those bridges so that in the future we can do better. Thank you.
Thank you very much. Distinguished participants, we are coming to the end of this regional conversation on promoting regional cooperation for enhancing equitable access to essential health products. We thank everyone for contributing to the discussion and providing such diverse perspectives. Your insights help enrich our understanding of the range of issues and challenges that need to be addressed, not only in response to the current pandemic, but also to help prepare better for future health crises. The pandemic has indeed provided us with many useful lessons for the future. Regional and sub-regional processes can play a critical role in addressing many of these challenges. They can serve as a basis for building back better and promoting improved access to vaccines, therapeutics, and diagnostics. To all participants, we also invite you to provide us your valuable feedback through our post-event survey, which can be accessed through the QR code you see on the screen now and the link posted in the chat box. Now, let me turn to Ibu Armida. The floor is yours for the closing remarks.
Thank you very much, Rupa. And first of all, I would like to extend our utmost appreciation and thanks to all speakers, plenary speakers, Mr. Nicolas C. Apinelu from Tuvalu, DSG ASEAN, Mrs. Satvinder Singh, from WHO, Dr. Simao, and from ICC, Secretary General, Mr. John Denton, as well as the eminent panelists that we just heard, Dr. Valerie Ulep from PIDS Philippines, Mr. Asha Menon, Miss Asha Menon, as well as Mr. Mark Rickinson from DHL, and Miss Suchitra Ella from Bharat Biotech International Limited in India. Yes, again, our utmost appreciation and thanks for your perspective, ideas, suggestion, and insights, and also how to move forward. So I would like to take this opportunity by directly proposing the 3 concrete steps forward. Having heard the many good suggestion and recommendation from all of you. First, we should make every effort for sure to scale up production manufacturing in the region. Again, Asia Pacific is a huge region, population-wise, as well as potential-wise, and while also addressing the supply chain, logistics, transport, and custom challenges, decrease the region's reliance on, one of the speakers said, right, up to now is highly concentrated, this capacity, especially with regard to the supply of essential health products. It's not only vaccine, but also diagnostic therapeutics. For us to be better able, prepared to, of course, to mitigate the current pandemic, but also to be better prepared for a future health crisis. Regional cooperation certainly can play an important role in this regard, from generating economies of scale in the procurement of essential inputs to leveraging relevant legal mechanism, as well as to securing more harmonized, standardized regulatory and policy framework. Second point is that we need all involvement, all support, meaning whole government, whole society, and coordinated approach, starting from financing, R&D, regulatory approval processes for all these essential health products. Again, regional cooperation can play an essential role in facilitating appropriate fiscal measures, the funding, internalizing, streamlining investment, financing mechanism. Several of you mentioned this, including forging more public-private partnership. And the third point is that we should continue our focus on regional cooperation. One of you also mentioned this, in sharing knowledge and resources. Countries, for example, can pool knowledge and manufacturing resources. In this regard, the WHO mRNA Vaccine Technology Transfer Hub, which is already being initiated in Africa to build capacity in low and middle income countries to produce mRNA vaccine, provides an excellent opportunity to countries in the Asia Pacific region as well. So therefore, regional cooperation is definitely needed to harmonize policies, regulation, and procedure for the production, distribution, and monitoring of vaccine, diagnostic therapeutics, so all these health products, as well as leverage such opportunities. And last but not least is, for sure, regional solidarity is a must. It's a must to ensure the resilience of such arrangement and sustainability also of such arrangement. We need to share lessons learned and good practices as we have done so amply today with this conversation. And for your information, that all the conclusion recommendation of this today's discussion will fit into the upcoming our 78th Commission session in May. Again, thank you very much for your contribution as well as engagement. Thank you very much, and back to you, Rupa.
Thank you very much. Thanks a lot for all your time, for your insights and sharing perspectives. We look forward to taking forward your recommendations, as mentioned, into our Commission session this May, and we look forward to engaging further with you in terms of improving preparedness for the future and averting future health crises as well. Thank you very much. Thanks to all the participants for being here with us and sharing so many interesting questions. Thanks a lot.